At CLEO Systems, we deliver flexible and innovative solutions to support healthcare providers at every level of care delivery, from standalone electronic prescribing to fully integrated patient management systems. Our suite of solutions ensures secure, resilient and efficient care, anytime, anywhere.
Hello and welcome to our series of VODCASTs with CLEO Systems. I'm Glenn Thompsett and it's my pleasure to welcome various people from the organisation to chat about what they do and how CLEO Systems can help you. Today we chat to Dr. Paul Perry. Paul is Board Medical Director at CLEO Systems. Paul, nice to see you. How do we find you?
I'm very well, thank you, Glenn, and thank you very much for having me here today.
Well, very welcome to the VODCAST. Lots to get through. We'll get through it in as quick a time as possible, but first of all, we'll establish your background, then we'll take a look at your role, the challenges that you and I'm sure many of the team members face, the technology and partnerships as well, and patient stories. Perhaps we can get a few little patient stories and the impact of policy changes as well. But first, to kick us off, Paul, tell us about yourself. How did you become involved with CLEO Systems?
Yeah, that's great. Thank you. So I suppose my background is a medical doctor to trade. So I've been a doctor for about 22 years now. Jings, it's quite long. I feel quite old now. And I've been a GP for about 15 years. So working both within daytime practice and urgent care space as well. Over those years, I've had various kind of, NHS senior leadership posts at a national and a regional level. And up until latterly, I've just become the Board Medical Director at CLEO Systems. And, I've been kind of working in that digital health space for about 10 years as well.
So you keep busy then, needless to say, with a GP role and your role with CLEO?
I do, I certainly do. And just to keep me on my toes, I've got a young family at home. I've got a 6-year-old and a 3-year-old, so yeah.
So you get very little time to do your own thing, really, I suppose.
Yeah.
What about challenges, day-to-day challenges? What, of course, are the biggest challenges faced by urgent care professionals today, Paul?
Yeah, I suppose it comes in, threefold, really. The first one is around, just workforce crisis or capacity issues within healthcare. And so over the last 5 to 10 years, we've had to really rethink about how we deliver healthcare, and particularly within those systems. The other piece really is around obviously increased demand, and what we found over the years, definitely since COVID, is we're all becoming a bit sicker over time as well, so that puts increased pressure on healthcare services. So from a healthcare delivery perspective, we need to think of new ways and innovative ways of working.
Our general health, it's fair to say, since COVID, as you mentioned, we're a lot more aware of that now, aren't we?
Yeah, we are. And, I think when the pandemic hit, there was lots more information out there in terms of, how patients could, look out for symptoms, how they can take care of themselves, and also how they can interact with that healthcare system, which is key. And I think digital technologies really, really did take off at that moment in time, which allowed both patients to interact with that healthcare system and clinicians, and also enables the healthcare system to hopefully improve its operational efficiencies to deliver better care to patients.
In terms of technology then, what should an urgent care professional expect from their clinical system, Paul?
Yeah, I mean, again, just reflecting on I suppose, my own clinical practice, and both in daytime and urgent care. And essentially what I want from an IT system is just really easy to use. It's intuitive, essentially just doesn't complicate my day-to-day clinical role, and also helps, me, I suppose, look at that patient record from a shared care perspective. So, even though I've got these patient notes in front of me, it's also just for me as a clinician being able to see, a bit more depth to that patient record. For example, if they're on other medications or have allergies, or actually the last time they went to see a clinician as well, was all really helpful to folk like me trying to help patients.
So trying to get across technology then in your role is vitally important, isn't it? Like most jobs these days.
Yeah, it is. And I think, gone are the days where, we used to kind of write on paper and have big files of medical notes. And now it's more, moving towards that digital technology space. And again, that feeds into obviously NHS England, particularly in terms of its policy and planning for healthcare delivery going forward.
Perhaps you can go into a bit more detail about how technology is transforming urgent care, particularly.
Yeah, I think that it's transforming urgent care in a couple of ways. I think the first thing is around it's just making it easier for clinicians to operate, to see patients, to become more productive, I think, in that space. It really does allow us to, improve patient outcomes, improve patient safety as well. Particularly on that safety point, it really helps me being able to see that kind of single patient record. So even though I might be seeing a patient at 2 o'clock in the morning, I can still have access, or at least see some of their notes from daytime practice, whether, they might be on long-term medications, they might have allergies, they might have other medical conditions that I would need to take into consideration when I come to make a diagnosis. So technology is making a really, really big part of that healthcare delivery piece.
And as a GP and somebody who works in the industry you work in, how often do you have to have like refresher courses, or do you go on courses generally to become more aware of technology?
Yeah, good question, Glenn, around technology. I think that it's helping both patients and the healthcare system. I think particularly from the healthcare system perspective, it allows, me as a clinician to see patients' records that they might have from the daytime practice. It allows me to see medications that are on long term, which again I need to embed into my decision-making ability, and generally just improving that overall patient experience. So technology is a real big part of that journey. And then the second piece as well is around technology helping that healthcare system, so to deliver better care, improve operational efficiencies, and generally just improving that patient pathway and that patient journey.
In terms of partnerships then, Paul, why is collaboration and indeed partnership working so important in the urgent care sector?
Yeah, it really is. And, a good example is CLEO Systems is owned and operated by IC24. And IC24 is an urgent care provider in the southeast of England, and they deliver care to 6.5 million patients roughly. So it's really important that a business like CLEO Systems, who operates in that health tech space, really works closely with the NHS partners who are operating on that shop floor and seeing the challenges and barriers on a day-to-day basis. So having that collaboration, that partnership on an ongoing basis allows not just clinicians to perform better on the shop floor, but also healthcare systems to embed that technology within that system to improve that patient journey and that care as well. And I think another example again is just partners that we work with both within the NHS and that urgent care space, particularly around electronic prescribing as one. So being able to digitally send a prescription to a local pharmacist, so a patient doesn't have to have a paper record that they may or may not lose walking down the street, and that the digital electronic prescription gets there very, very quickly as well.
We mentioned at the top of the introduction that you'd probably share with us a patient story or two. Can you share any memorable moments that highlight how technology has helped in the urgent care sector?
Yeah, I recently saw a patient in the kind of out of hours urgent care space who was elderly, so lived alone at home, had a few medical conditions and things wrong with her. She was on lots of medications as well, and the ability for me to be able to see that from her daytime GP record was just fantastic. It allowed me to be able to kind of work out what might be causing her confusion. It also allowed me to see that shared care record and the shared care summary. So it allowed me to look at their care plan in terms of what her wishes were. So again, just allows me to make better informed decisions with my patients going forward. And then the other really good example as well is again, seeing a patient at 2 a.m. Allowed me to consult with a mother who was a parent of a child I was seeing, but on telemedicine, on virtual tele, just looking at the child's rash on the video camera, being able to make a diagnosis. So therefore, this patient who lived miles and miles away from the urgent care treatment centre didn't have to come down to see us. They could sit in the comfort of their own home. I could reassure the mum. I could give them a treatment plan, and again, it just really improved that patient journey.
Who'd have thought years ago that we'd be diagnosing problems via camera, via mobile phones. Quite incredible, isn't it, really?
It is. Things have really come on a long way, haven't they, since those days?
Let's talk about the impact of policy change then, Paul. How do recent policy changes affecting urgent care services? And perhaps you could highlight the Darcy report and the 10-year plan for us.
Yeah, the Darcy report recently came out a couple of months ago, didn't it? And that was really looking at a couple of elements. And I think just to tease out two of those particularly, I think the first one is around technology. And, there's very much within that report a move from analog to digital. And, let's be honest, we've known this for a number of years that we need to be in that digital technological space. But now at least there's a further driver and a push behind that, particularly from NHS England. And the second piece as well is around, again, reflecting on my GP background, is that, I want to be able to treat my patients closer to home, or at least as close to home as we can get. And again, that's a big part of that Darcy report that's just come out. So again, with these policies and reports that come out, it gives a driver and a push for NHS England to move in that right direction. And hopefully there are budgets and funding streams that come with that as well.
All right, well, listen, great to talk to you, Paul. That's Dr. Paul Perry there. Paul is a board medical director. Thanks for joining us on the VODCAST today. And thank you for watching. Until our next VODCAST, take care. Bye-bye.
CLEO Systems, simplifying connected care.